Okay, and for our final section, primary care issues. So this final set of slides, we're going to discuss symptoms that point to conditions that are serious enough that they absolutely shouldn't be ignored, but they're not eminently life-threatening, so they don't need immediate care or urgent care. So this is a pretty big category, and we're going to talk about it in subsections. We're going to talk about symptoms that point to possible cancer, symptoms that point to possible inflammatory bowel disease, symptoms that point to possible pneumonia, bronchitis, or asthma, symptoms that point to possible diabetes. We're going to visit persistent fevers, persistent fatigue, and all the things that those might point to. We'll cover the symptoms of urinary tract infections, and then we'll talk about heavy or unusual menstrual bleeding and changes in bowel or bladder habits. So let's start with the cancer signs. There's a lot of them. And as you'll notice as we go through these, there are potentially other reasons people could have any of these symptoms in isolation. But if you see them in combination, you don't have to have all of them, but if you see 2 or 3 of them in combination, that's not such a great sign. And if you find another reason for these, and it's only one of them, then you can probably assume it's that new reason or the reason that you found. But if you find multiple ones of these, even if you've found other reasons for each one, it's still worth ruling out. Okay, so possible signs of cancer. This is going to be a fairly long list, and as you'll see, a lot of these symptoms are fairly vague and could have lots of other potential causes. If you see just one of these by itself and there's an obvious other reason for it and they don't have any of the other symptoms, it's probably not cancer. But if you see more than one of these grouped together, then cancer really should be ruled out. The central symptom that we really want to watch out for is sustained weight loss of more than 2 pounds per week that isn't explained by something else. So even if somebody is on a rigorous weight loss plan, healthy weight loss usually is not more than 1.5 pounds per week, and that is usually not sustained ongoing. So if somebody is not on a diet and they haven't changed their exercise and they're losing weight and they don't know why, that by itself is a reason to check in with the doctor and hopefully rule out cancer. Now, if somebody's made a radical diet change and they've just started exercising and they've lost 2 pounds a week for 2 or 3 weeks, that's not something to worry about. But if they've been losing 2 pounds a week for months and there's no reason for it, that's when we need to worry about it. So that plus any of these other symptoms really needs to be worked up for possible cancer. So other possible cancer signs are unexplained chronic low-grade fever. This could also be a chronic infection when it's not in the context of anything else except for maybe fatigue. Fatigue that's not improved by sleep or rest. And again, this by itself has a whole lot of reasons. It can be hypothyroid, adrenal fatigue, sleep apnea, long-term intensive stress, low blood pressure, chronic infections, high blood sugar, low blood sugar. It can be a lot of different things. But if it is in the context of some of these other symptoms, then it becomes a possible cancer sign. Any unexplained changes in bowel or bladder function, or we say maybe bowel or bladder habits, so you suddenly aren't going as much, or you're suddenly going a whole lot more, especially in the context of there also being unexplained blood in the urine or the stool. More possible cancer signs, looking at skin, any skin lesion that doesn't heal, even if it doesn't look bad, but it just keeps crusting and bleeding, but it never goes away, or any skin spot or mole that has changed color or shape quickly in the last month. Those are both sort of ominous signs. Deep bone pain with no history of injury, especially if it's in the pelvis or the legs. Persistent back pain with no history of injury. Again, this could be other things, and it can actually be a musculoskeletal injury. You can herniate a disc and not know when it happened. So that's possible. But If people have gone to physical therapy, they've gone to get massages and acupuncture, chiropractic, and nothing's changing it, then that becomes a possible cancer sign and needs to be worked up. Breast lump or discharge, that one is fairly well known as a sign of potential breast cancer. Vaginal bleeding after menopause. So if a woman has not had a menstrual period in a year or more and then suddenly has vaginal bleeding, that is really pretty much the only thing that could be is endometrial cancer. So that's a definite cancer warning sign. More possible cancer signs: headaches that never go away, they're in the same spot, and they get slowly, gradually worse over weeks to months. Another one related to this, gradually worsening issues with vision, hearing, coordination, or speech. That could be a series of tiny strokes in the same area, but combined with that headache, we'd be looking at a potential brain tumor. Any dry cough that has gone on for more than 6 weeks, there are other reasons for that, especially in places like Austin where we've got allergies all year. But if somebody has had a dry cough for more than 6 weeks, there's no other obvious reason for it. And benign things like reflux and allergies and things like that have been ruled out, especially if they get little streaks of blood in their sputum. Those are both potential signs of lung cancer and should be worked up, usually just with a simple x-ray. Any new onset of constipation without significant pain or nausea. Dark, tarry, or coffee ground stools. So those are usually a sign of a GI bleed. This could be an ulcer, it could be ulcerative colitis, but it could also be cancer. So that also needs to always be worked up. So moving on from cancer, looking at changes in blood pressure. Any blood pressure above 140/90 needs to go to primary care, assuming that it is a change for them. Blood pressure below 90/60 with stable symptoms of weakness and lightheadedness. If somebody has a blood pressure below 90/60 and they feel fine and that's always their blood pressure, no big deal. If they have blood pressure of 140/90 and it's been like that for a long time and they don't feel different and it's not a change, no big deal. But if there's a change in their blood pressure that hits one of those two thresholds, then they really need to check in with their doctor. Signs of possible heart or kidney failure are ongoing swelling or edema of both of the lower legs, especially if it's pitting edema, meaning that if you press your finger into it and lift your finger off, a dent remains in the swollen area, especially if it's accompanied by shortness of breath, which is worse lying down, resulting in someone having to sleep propped up. So if you see that combination together, we're looking at possible heart failure, kidney failure, or a combination of both, and that should be worked up. Heart palpitations. So we discussed these in a couple of the other sections. If the heart palpitations are occasional, if they're brief, and by heart palpitations we mean the sensation of stumbling or fluttering of the heart, and if they happen after stress, people might get a little bit short of breath or lightheaded, but they shouldn't last very long. If they last for a long time and people get really short of breath, they should probably go to urgent care or even the emergency room. But if it's just occasional, especially if it's after stress, this is usually what's called a benign heart arrhythmia called PVCs, or pre-ventricular contractions. And as I said, they're benign and they usually pass after the person's body has recovered from acute stress. These can also be helped by little things like hawthorn berry and taking enough potassium. If somebody has fainted recently or have been feeling faint frequently when standing or when exercising, there's a couple of different issues that could be. We would look at blood pressure and hydration issues, but if it persists, people should definitely go check in with their primary care doctor. Okay, this particular trio of symptoms: hoarseness or sore throat for more than 3 weeks, accompanied by difficulty swallowing and a sensation of a lump in the throat, maybe tenderness when palpating the front of the throat, Those are symptoms of possible hyperthyroid, autoimmune thyroid goiter, or reflux, but they could also possibly point to throat cancer. So if you see those and they hang around for more than a few weeks, a visit to the doctor is in order to get that evaluated. Okay, the classic signs of diabetes: fasting blood sugar over 126, hemoglobin A1C over 5.7, the person has become very thirsty, frequent urination, unexplained weight loss, sticky, sweet-smelling breath, possibly sticky, sweet-smelling urine, and severe unexplained fatigue. I've seen this happen in even people in their 20s and 30s where they'll have an autoimmune attack on their pancreas and suddenly become type 1 diabetic. And they haven't had blood sugar issues in the past. So it is, if you get the symptoms of suddenly thirsty all the time, peeing all the time, losing weight, sweet breath, and severe unexplained unretracted fatigue, it's time to go to the doctor and make sure they check your blood sugar and their hemoglobin A1C. All right, so looking at problems with the liver and the intestines. If the abdomen becomes distended and really firm, so hard, so it's not fat sticking out, but you can tell there's something firm underneath the muscles, and especially if there's any yellow tinge to the skin or eyes, either one of those by themselves points to a possible problem with the liver. They don't have to be together. Possible inflammatory bowel disease, so that would be Crohn's or ulcerative colitis, or diverticulitis. That's going to look like a new onset of painful bloody stool, usually a tender abdomen, so it's like tender to push on it, possible fever, possible pus in the stool. These can either be triggered by or result in depression or anxiety and triggered by intense stress. Gallbladder problems. So the classic symptoms of issues with the gallbladder are pale clay-colored stools and or fatty stools, so either seeing a sheen of fat on top of the toilet water after passing stool, or fatty stools that float. Colicky upper abdominal pain when eating fatty foods. The pain in the upper abdomen can radiate to the shoulder or back, and if any of these happen suddenly and they're really severe, then that actually takes this from being a primary care issue to an emergency room issue. So what can happen is the gallbladder can be chronically inflamed and it can get colicky and crampy. It can develop gravel in it, which makes it harder for the bile to flow through. But if the gravel condenses into stones and one of the stones is the right size to fit into the bile duct and get lodged in it and obstruct the bile duct, that becomes a medical emergency. So that's sort of the scenario that we're trying to think through there and reason out whether this is an emergency or not. Any abdominal distension that's gradually worsening and doesn't change with eating or fasting, you should go to the doctor if that's been going on for more than a few weeks. Again, there's a good handful of things that this can be, but a fair number of them are not that great. And so you'll probably need to go to get an x-ray and then probably either an ultrasound or CT to get that fully diagnosed. Abdominal pain after meals or before meals, or with a history of prolonged NSAID use. So abdominal pain after meals can be IBS or food allergies. Abdominal pain before meals, so basically your stomach hurting worse when you have an empty stomach, can be an ulcer. Anytime somebody has used NSAIDs, so things like Advil or aspirin, for a really long time, it can really strip off the protective mucus lining in the digestive system and make the gut much more sensitive. So anytime somebody has a chronic low-grade abdominal issues, we always want to ask if they've been taking NSAIDs for a long time. But regardless, if they have those symptoms, they need to go see their primary care doctor. Vomiting that's been lasting more than 1 week, but they're not faint or lightheaded, and they maybe only vomit once or twice a day, so it's not uncontrollable or unrelenting. Same with diarrhea. If you see red blood in the stool, that's usually a hemorrhoid. So the primary care doctor probably has tools to assess that, fix that, or they can refer to a gastro to fix it. Tarry or coffee ground stools is again an upper GI bleed, and any new onset of constipation. And this again has many possible causes. Possible urinary tract infections. The classic symptom of a urinary tract infection are frequent urination, discomfort, and it's usually a burning or cramping pain either before passing the urine, during, or after. Lower abdominal colicky pain. If it progresses and somebody's got a low-grade fever, chills, and pain in either the low back or the mid back, those are signs that the infection might be migrating up towards the kidneys. So getting into the doctor a little bit more quickly at that point is more important. Gradual onset of numbness or tingling. If it is just one side, like your arm or your hand or just a couple of fingers, that's probably a pinched nerve somewhere. If it's symmetrical, like it's both hands or both feet, it's more likely to be something systemic, like a nutrient deficiency. If somebody has a gradual onset of numbness or tingling in the saddle area, so basically the crotch, without any changes or urine or bowel habits, that is a sign that they may be starting to get pinched nerves in that cauda equina area near the sacrum. So that is definitely go to the primary care doctor and get a referral to get that imaged. But it's not life-threatening until the urine or bowel habits change. Any headache that progresses slowly over days to weeks, a headache that won't go away, or a headache that keeps coming back, that's worth a trip to the primary care doctor. Okay, issues with the female system. So any prolonged or very heavy menses, disappearing menses, they've stopped coming, unusual or uncomfortable discharge, breast lumps or breast discharge should all be worked up by the primary care doctor or the gynecologist if you have an OB-GYN. Psychological issues, so any changes in mood, especially with changes in menstrual cycle, mood or sleep issues that are disrupting daily life, and any decrease in concentration or memory. Any of these that are noticeable and persistent enough that they have changed the way you're able to work or interact with your family or your loved ones or get your daily tasks done, those need to go to the primary care doctor and get worked up. So as you can see, there are a lot of things that should probably be seen by a primary care doctor. Just a quick review, some of the highlights here were persistent fatigue, persistent fever, fainting with exercise, chronic coughs, any changes in digestive system, any changes in menstruation or female cycles. So those are the highlights in the big pictures. Okay, so that concludes our course today. I hope you have found this both instructive and helpful, and I look forward to seeing you in the next course.